Johnny Vegas is back on our screens tonight talking about his ADHD diagnosis. Good morning. Dr Amir is here to have a chat about all of this. It's interesting, the documentaries. There was one last night and Johnny Vegas is one tonight, Amir. And I think it's interesting because so many other celebs are willing to shine a light on the condition. We've got Olivia Atwood has spoken about her diagnosis, will.i.am, Mel B. And that's important, isn't it? So that people can understand that, you know, you can have this condition, you can be hugely successful, but you have to be able to manage it. And there's an honesty about it.
Yeah, absolutely. I think it's important when celebrities like these people speak about a condition like ADHD, which 2.5 million people in the UK live with. Now, these two documentaries that we're seeing this week, last night we saw Dr Karan Rajan and Dr Claire Mosley talk about the complexities of ADHD, but really importantly, what it's like waiting to see someone for a diagnosis, because wait times for that are very, very long. Johnny Vegas talking about it there. We saw him creating an artwork which he's going to put on show in his hometown, and talking about how difficult it is as an adult, because he was diagnosed at age 52, and there's lots of adults who are looking for a diagnosis. When celebrities do speak about it, it helps break that stigma. It normalizes neurodiversity, and it helps people recognize symptoms in themselves so they can go and speak to someone and get a diagnosis if they think that that's going to help them. So yes, I think it is important when celebrities speak out about their diagnoses.
But Amir, obviously this condition, it's always been there. It sort of feels like it's on the rise at the moment, but that is simply, I guess, because we're talking about it and it's being recognised much more now.
That's right. So we are seeing an increase in diagnosis and treatment of people living with ADHD. There's about an 18% increase of prescription medication for those living with ADHD in the last few years. And we're seeing lots of people search for ADHD on social media websites. It's one of the most searched for health topics on TikTok, and it's getting about 20 billion views. So it's a huge thing that people are interested in. And I hear all the time, you know, why is there so many people being diagnosed with ADHD now? It feels like everybody's got it. Actually, that's not correct. What we're getting better at is recognizing it, diagnosing it, and people coming forward with symptoms. ADHD is not something you develop as you get older. It's something you're born with. It's something that is there right from birth. And it's a problem, not a problem, but a difference really in the brain, with the brain chemicals that makes you see life differently. It makes it difficult to process emotions. It makes it difficult to process order and follow instructions. But it's just a different way of looking at the world. And we're getting better at recognizing it and hopefully treating it and managing it. And what the world needs to do is get better at being kind of working alongside people with neurodiversity, because it's really hard for those people to live in the modern world.
Yeah, and so many people, though, there's Johnny Vegas at 52, so you've lived your whole life with a condition that has been either misdiagnosed or not spotted at all. I'm assuming it's much better to be given a diagnosis when you're quite young, as opposed to much later in life.
Yeah, having a diagnosis when you're younger helps put a name to the thought processes in your head that feel very different and can feel very isolating when compared to those people who are not living with neurodiversity. So that having a label for those thoughts is quite useful, and that might be enough for people. For younger people, they can get support, they can get medication, particularly through education and schools where they certainly need it. I think what's missing in this conversation are people older adults, because remember, we've only really discovered and diagnosed ADHD in the last 10 or 15 years, but it's always been there. And there's older adults in their 50s, 60s and 70s who've had it and may go and see their doctors because their symptoms can get worse as they get older, particularly for women, with things like forgetfulness, difficulty processing order, following instructions, losing things. And they can often get misdiagnosed with cognitive impairment, even dementia, when actually they're living with ADHD. So there's a lot of catching up to do for us in the medical world so we can diagnose it better and manage it better for older people.
Of course. Is it true, Amir, that ADHD is recognised less often in women?
It is. Women get a raw deal throughout their lives when it comes to ADHD. So normally people, when they think of ADHD, they have this kind of stereotype of a young boy being disruptive in class, not listening, jumping on tables, whatever. But actually girls present very differently. They can daydream, they find it difficult to follow instructions, they can be anxious. And these young girls grow up to mask their symptoms, and they can become perfectionists, they can become high flyers. As they get older, a lot of their symptoms are put down to hormonal issues, anxiety, depression. But then the menopause hits, and this is where it really gets serious because estrogen helps with that masking. With ADHD, there's a difference in the chemical structure of the brain when it comes to things like dopamine, noradrenaline, serotonin, things that help with mood and focus. Estrogen helps keep that balance a little bit, even when you've got ADHD. Without it, in the perimenopause and the menopause, those chemicals become really misbalanced. And that can make it difficult for these women to mask their symptoms. So they get the symptoms of the menopause, and then their symptoms of ADHD get worse as well. And we often see women who have been high flyers in work, in life, really struggling with symptoms of the menopause and ADHD because they've been so good at masking it, finding it impossible. And that really needs more research and better treatment.
Yeah, of course, Amir. And there are, of course, medical treatments, but that isn't a magic fix for everyone.
Yeah, it's not. Medication can transform lots of lives, but it might not be what everybody wants. So having things like routine apps, planners, timers for things can help as well. Getting CBT can help too. That's talking therapy. And good nutrition and good exercise is thought to help too. But always speak to a healthcare professional. And the one last thing I will say, there are lots of long waiting times across the country to getting a diagnosis. But if you Google right to choose ADHD, you can find the shortest wait time in your area or outside your area. And you can ask your doctor to refer you there. And if it's a child, ask your school nurse to refer you to that. So Google ADHD right to choose to find the shortest wait time.
Looking for more health and wellness content? There's plenty more right here on our channel. How about you check out this one?